an aging population presents opportunities for people to make the most of longer lives, new challenges, and new challenges for adaptations are not made to how societies are structured across all sectors. So we must remember that the aging populations are a sign of success, that people are living longer, but we need to be able to respond to that effectively with the right types of policy solutions and technical solutions in the way in which we deliver all sorts of services. And we were talking yesterday about the implications for the transport sector, today looking at the health sector and some of the scale of impacts using Brazil as an example. So just to give you some useful statistics to contextualize this, within the next 5 years, 20 million more people will reach 60 years old or above within Brazilian society. So go from 30 million to 50 million people aged over 60. That's going to increase demand for all of the health-related care that those individuals will need as they move into that phase of life. As a 40% increase in the number of people. If we were to use that increase in demand and from our healthcare modeling, we would say that the implications of that in terms of the new facilities that would be required to provide high quality healthcare to those individuals would be nearly 1,000 new healthcare facilities of varying sizes and scales. But if we were to take all of those facilities together, the carbon impact of providing that healthcare would be close to 9 million tons of carbon in terms of embodied carbon and operational carbon from those facilities. So just to contextualize that, we're talking about nearly 20 million flights or 20 million homes where all the heating and power is provided for the course of a year. It's that kind of scale of impact just by accommodating that additional demand, not even the base loaded demand, just the additional demand, equivalent to 13 million flights from London to Sao Paulo, which for those who've been taking those flights, you realize it's quite a long way and it takes quite a long time. So the risk that we face is that if we continue with a business as usual approach in trying to respond to this growing demand from our aging society, the cost of providing that healthcare becomes very sizable and effectively unaffordable for many economies. We also risk significantly exceeding our carbon budgets in relation to healthcare, which we know is already nearly 5% of global carbon emissions are related to the healthcare sector. And we also importantly risk creating a very poor patient experience. So as Mary will come on to talk about, part of the solution to this is having more localized, more patient-focused care that can deliver the same health outcomes using new technologies and new ways of delivering healthcare that is much lower impact throughout the life cycle and is also crucially better for patients. So with that introduction, I'll pass across to Mary, who will talk about some of the solutions.
Thank you, Adam. All right, so what we put together for you in terms of working on this 9.2 million tons of CO2 is 4 different strategies that we're proposing to get in terms of the solution. Our first, can we go back one? Sorry. So the first one being a service strategy in terms of delivery. The second looking at the total real estate of any healthcare organization and how they may kind of look at this from a strategic standpoint. Next is our smart and working on operational efficiency, and lastly the embodied carbon to pull together the whole life carbon approach. Next. So with our first strategy, as we're working on a new delivery model, we can get up to a 2% reduction. So taking that 9.2 down by 1.8 million tons of carbon. How we might do that is first working on where are folks getting their care. We learned a lot from COVID in terms of who really does need to go to hospitals and who can receive more of the care at home through from a virtual model to a visiting model. And as we know, about 25% of that can be served, which lowers the amount of beds that we have in our hospital. And then also, we do not have the hospital-acquired infections And those that that are home as well, they're going to heal faster because they're not going to have the stress of the facility itself. And then the flexible care model as well. As we kind of look at the demographics and what's happening in different areas, we can kind of start to see what kind of diseases are we dealing with in certain seasons through the year. Are we having flu epidemics in certain locations or pneumonia in others, which means different models of care, different equipment that's needed, and then more with the modular units, we can respond to those as opposed to having this hard-built building to have to deal with it. And our second strategy, we're going to increase the reduction by another 6%, concentrating on the overall real estate and approach. And so here was a study that we did over at Perkins and Will, where we looked at quite a few hospitals to see what would happen if, and I'll show you those hospitals here in a second, but if we looked at overall circularity from the building itself down to using the building as a materials bank. And if we were being conservative with this approach, and we said if every healthcare organization looked at that portfolio and they were to reuse 1/3 of their stock of buildings, that would have a reduction of 43% overall in terms of their carbon impact. Our third one, of course, is operational, and our operational carbon approach, and yielding our largest reduction with 36%. And here's, of course, what I think many are used to from an operational side, looking at the passive strategies. But when we're looking at hospitals and you're looking at labs and you're looking at these load-based buildings, it's the operational, the load-based systems that are going to make the biggest impact. So we can, of course, can concentrate on the passive systems, but it's that 50% of load reduction that happens within the active systems and then the operations themselves where we want to concentrate. Here's just a couple of examples too of where we made some pretty drastic reductions. The American University of Beirut Medical Center in Lebanon was one that used Spalding Rehab Hospital that we designed over in Boston, Massachusetts as an example. We were actually, for the first time, able to pull in passive cooling in the United States. And what was incredible about this is it was a resiliency strategy. In Boston, we were facing quite a few hurricanes, and one thing that you can get a CEO's attention on in healthcare is the building cannot go down. And so if we're able to shift the energy loads from some of the bed units and have the passive cooling, those can be reserved for the emergency systems, and you can stretch your emergency systems 4 times longer in the event of an acute weather event. In addition to this, we're looking, the CEOs that we're working with and the executives are looking at metering and the systems and how they're performing on a regular basis so they can get ahead of the issue before it happens, can replace it, right, before the system goes down. The biggest thing for them is keep those beds operational, and they'll listen to this. But the amazing thing is they're seeing all the way up to a 30% reduction in operational energy savings. And then lastly is our embodied carbon to give the whole life cycle profile reduction, adding anywhere from a 16 to a 20% increase to our overall reduction. And so we've already kind of talked about the building stock and how we make and use it in a circular approach. But looking at embodied carbon itself is pretty spectacular in terms of what it can do, because how massive these buildings are. So I mentioned that we have been doing a project where we were looking at the overall life cycle of our buildings. We looked at about 500 different projects. 6 of these were hospitals from across the U.S. And on average, we were looking at about 340 kilograms of CO2 per square meter. That was, okay, well, how can we continue to get that reduced? What do we need to concentrate on? So we concentrated and looked at these case studies, and of course, being the beasts that they are with their tremendous amount of structure because of equipment load and people, we're concentrating on the structures And the concrete mixes, certainly the piers, the massive piers, and the slabs that we're dealing with. We can move to the exterior skin of the building and the insulations, the mullion system, et cetera, and then the bulk interior materials. And what ends up happening is, in this next slide, is that by the time that we're in this efficient design, modular design, and we get down to the materials themselves, we have at least 50% of the embodied carbon reduction that we can make just by through the material selections. One thing that I want to mention that's kind of tangential to when we're looking at carbon and we're looking at emissions, we know how much emissions impact societal health. They also affect the interior of the building. So as we're looking, oh, can you go back? Sorry. So as we're looking at the materials that we're using, you have to be careful of what they're based on. When we're looking at some materials that are fossil fuel based, it means they come with all kinds of other toxicants, such as metal plasticizers, phthalates that are, right, so that they can be malleable, and of course, flame retardants. And when we invite these in, we're inviting in the carcinogens, and we're inviting in the endocrine disruptors, many other health impacts, negative health impacts that you don't want to deliver in a health delivery model. So what is fabulous about the healthcare organizations that we're working with is they're addressing this at scale. We're starting to work on complete standards that are addressing embodied carbon in materials, health in materials, and circularity. The other thing that we've been working on at scale is the energy delivery. And so this was an example from Swedish Hospital in Seattle, where we work with the city of Seattle, and we were able to take and work with them on reserving the waste heat as a source for adjacent multifamily buildings. These are folks that are actually working at the hospital itself. And so as opposed to for them needing to create all of that, we're using this waste heat actually as an energy source. And then creating almost a network, working towards creating a network in the city of Seattle. So all in all, what you can see is we go from 9.2 to 2.1 million metric tons of CO2, so about 20% left that we need to work on. We've got about 5 years to work on that solution. Of course, there is the offsetting, but I think we're invested in the continued research to get to that 100% solution.
Thank you so much, Mary. That was brilliant. Thank you very much. And really good to see some similarities in the solutions. I'll move away from the speaker. Similarities in the solutions that we're seeing in the US to the UK. We're working on a hospital in North London where they're trying to do a similar thing, sharing the heat from waste heat from the hospital with local affordable housing projects. So yeah, it's interesting to see similar solutions there. Thank you. Would you like to take a seat here? And I'd like to invite Liz to the stage now just to give some reflections on a slightly different topic, but very much related and picking up on one of the points that Mary made around the importance of the materials that we have and how that influences air quality, and also obviously ventilation and other factors influencing air quality, something that Liz is very passionate about. She's a senior policy counsel at the USG Green Building Council, and yeah, very much like to hear your reflections on that.
Thank you. How's everyone doing? You can we're experiencing less than ideal indoor environment right now, right? And you can tell it makes a difference, makes you sleepy, it's harder to pay attention. So this is real, right? So I'm with US Green Building Council. We're a mission-based nonprofit. We've been around for 30 years, and our goal is to transform buildings and create and support a world that's sustainable and healthy for all. We use various tools and platforms to do that. We leverage LEAD, our biggest tool in the toolbox, but also education, credentials, training, events, and policy. Okay. To do that. And with LEAD, we now have over 13 billion square feet of certified space globally. So I want to congratulate Perkins and Will for that work. It's really impressive to see when you take an intentional approach to a clear goal, what you can do, and the strategies that evolve from that process. And I think that's a big learning opportunity for others. And just adding to that, what we are trying to do with the LEAD program, and we have just launched the latest version, LEAD version 5, at the end of April, is to really push that lever and push what it means to be sustainable and to support health. And one of the places we've done that is with indoor air quality, where we're really increasing the practices and particularly trying to push a more proactive approach to monitoring, testing, and evaluation, and as a core strategy to then feed in to meeting enhanced standards for indoor air quality. And we're trying to offer clear advice, clear strategic actions that can be taken by all projects to support better indoor air and better sustainability. So with that background, we were very excited when we learned that 2 professors had this idea to launch a new global coalition to work specifically on healthy indoor air. And we are lucky to have Dr. Bronwyn King here, and she was joined by Dr. Georgia Lagudis, one from Australia, one from the United States, to bring this coalition together and launch the Global Pledge for Healthy Indoor Air. And this is really the first time that there's been a global group that is acknowledging, recognizing, and elevating healthy indoor air as a basic human right for everyone. So we can't underestimate the importance of this global pledge. And this came together on September 23rd at the UN with a high-level side event. Also happened to be Climate Week New York City, so that was advantageous as well, because we know we have to solve these things together. We have to get out of the silo and really bring public health together with building practitioners and be working on climate, health, indoor air, resilience, biodiversity. We have to solve for these problems in an integrated way. For the Global Pledge, we had France and Montenegro were the initial countries that helped sponsor it as a UN entity. Funding signatories, organizations from around the globe. We were very proud to be one of those and be present. And really this represents a new chance to work together and elevate healthy indoor air as an outcome and as a practice throughout all of our different circles, no matter what country you're in, whether it's healthcare or affordable housing and everything in between. This also ties to the SDGs, so number 3, which is about health and well-being, and then of course 11 on sustainable cities and communities. So there's a lot of tie-in there. And what this really is about is, first of all, recognizing the importance of healthy indoor air. So that's first and foremost in the context of individual health and population health, like pandemics, workplace safety. So there's sort of a full range of aspects to what it means to have healthy indoor air and the consequences of not paying attention to it, importantly. Secondly, to prioritize and advocate for healthy indoor air. We know how to do this by and large, but we have to make it kind of the new business as usual and make this part of how we do things every day in our buildings. Also collaborating with stakeholders and sort of growing opportunities, which is partly why we're here at the Buildings Pavilion, because we know the public health community talks to ourselves, the building community talks to ourselves. We need to talk to each other and really work on projects together. So I think it's a great opportunity. So those are some of the key commitments under the Global Pledge, and you can learn more at airclub.org, and you can sign on as an individual or an organization and learn more from the tools there on that website. There's also a new global commission that's been launched, so that will be another place that can create collaborative projects and specific outcomes for people to work on. So I think it's a really exciting moment for healthy indoor air and trying to integrate that along with our decarbonization and so on. So thank you.
Thanks. Thank you very much, Liz. That's really interesting. And is there much correlation with, say, some of the standards within LEED or the certification schemes and the measures that would be required to respond to the Indoor Air Quality Compact? Sorry,
Yeah.
right next to.
Yeah. So, well, first of all, the LEED program kind of looks across available standards and pulls from those as references. So we have quite a few of the ASHRAE standards are incorporated into LEED, for one thing. And then our sort of fellow green building councils and other green building systems, I think by and large have also been working on better indoor environments over the years. So we, learn from each other and sort of help push the design community, the operators, the real estate, all in that same direction.
Thank you very much. I'll stick to one microphone, I think, from now on. I'd now like to invite Julie Kristrup from Vilex to join us. She's the head of thought leadership at Vilex and is also the president of Energy Efficient Buildings in Europe, and would like to talk to us about the opportunities for integrating health and well-being into new building construction.
Yeah, thank you so much for the introduction and for inviting me to be. Who has the clicker? Oh, you're the clicker. Okay, cool. Please click. Slides? Okay, maybe there are no slides then to be found. That's okay. While we're waiting for that, I work for Velux. We produce roof lights and roof windows and skylights, rather, or as we like to say, fresh air and daylight, of which, of course, there's absolutely none in this room. And I'm here to talk to you primarily about the work we've been doing since 2015 on what used to be the Healthy Homes Barometer. It's now called the Healthy Buildings Barometer. And what we want to do there is basically build on the sort of work you're doing, because you're looking at how you can make sure that the hospital building itself is healthy, whereas we want to quantify the effect of keeping the people within the buildings healthy. Certainly in European terms, the vast majority of our legislation on buildings is energy focused, because that's simply where the competence is at political level. And that means that it's very difficult to have a conversation about health, because, to your point, the people who talk about health sit in a different department elsewhere, and they're measured on a different thing. And so that correlation is very, very difficult to find. So what we've been doing since 2015 is to gather data on the impact of bad indoor environmental health on people, but also not just the health and well-being element of it, which sounds a little bit sort of like cozy and like a nice to have, but the financial impact of that bad indoor environmental health, or conversely, the positive impact of having good indoor environmental health. And I really would like to have more slides here, but I can tell you, for instance, that a performance in an office that has access to natural daylight is about 10% better than if you don't. If you're talking about the overall indoor environmental air, we're talking about a 9 to 18% span, both in offices, but also in schools. So basically, if you're not happy with the outcome of this COP, know that it could have been 9 to 18% better if we'd had daylight and proper indoor air. We also have some really interesting figures around hospitals, because not only do we save a lot of money by being in well operated spaces, patients actually also heal faster. And it makes sense. If you're like in a place where you feel comfortable, where you have access, if you're connected to nature, that was one of the metrics you mentioned, if you have access to natural light, if you have good indoor quality, then you quite simply heal faster. Now that's excellent news, of course, to the patient and their families, but it's also excellent news for the healthcare system. Because one patient out, another one in. It's the same about the schools, right? If your kid is less ill, that also means that you as a parent have to less time off. So that sort of like augmented effect all the way through the chain is very, very significant. And actually so significant that we ought to be, having buildings to those standards just for the sheer sense of financial saving. Then you can say, is this something that we talk about here in COP and no one in the real world cares? No. We just did a survey with YouGov. We ran it with Builders Performance Institute Europe, with whom we do this project, and we asked people in 6 countries, so France, Germany, UK, Denmark, Italy, and Poland, a range of questions about indoor environmental health, how important they thought indoor health was, and whether or not they perceived the buildings they were in to actually live up to standards. And not surprisingly to anyone who sat here, many people agreed that they had in fact got that the indoor conditions they were met with were not significant. We measured across 4 groups of buildings, so homes, offices, schools, and hospitals. So a vast number of people across those 4 groups said, no, actually we don't think our building is up to scratch. And what was also interesting from a European perspective, because we've only just recently started talking about sort of overheating in any sort of significant way, is that about 10% of people were worried about being able to heat their space, but about 45% of people were worried about being able to cool their space. And so that, of course, is a huge challenge that we're facing in Europe in the years to come, because we don't have the sort of air code culture you have in other parts of the world, and also can't afford to have that, frankly, from a climate perspective, right? It's a huge, huge challenge. We also asked people whether or not they wanted more regulation in this space. And about 60% said, yes, we'd like to see more regulation on improving the health of a building. We asked them whether they'd like to attribute more public funding to it, knowing that that would mean taking funding away from other areas. And that's important, of course, because otherwise people just like, yes, please, let's take more money, right? And again, about 6 in 10 Europeans said yes. But then we asked them if they were aware of existing legislation in the area, and 70% said no. So, and that just illustrates, right, that people do care, but also that people have no idea what's happening out there, which is why it is so important to have these sort of conversations, that it is so important to talk sort of across, outside of our little silos, to actually make sure that that message gets out. And finally, and I'm still riffing because I can't see my slides, as part of the Healthy Buildings Barometer, we also sat down to define what actually, in our opinion, constitutes a healthy building, because in European Union law, there is no definition. And so if we don't agree on what it is we're actually trying to achieve, how on earth are we then going to see if we're getting there? And so we came up with a definition based on talking to various sort of experts that had 5 elements. And the point of that is the point of the entire discussion here, which is that it combines these sort of technical elements that you were talking to with the elements around health and well-being, but also about the people and this sort of people-centric and community approach. So you can create a set of integrated principles that together make for a healthy building. And the final thing we did was that we tied it to a European piece of legislation, the Energy Performance of Buildings, that all member states in any case have to implement. Because with that, we avoided else that they also need to take care of. We said to them, look, people, as you're already implementing this piece of legislation, of course on time, and as ambitious as it ought to be, why don't you also take the opportunity to do these few bits that will then also improve the indoor environmental quality of your buildings? We did the report in English and in Brussels, and we also have member state versions, a number of member including France, Italy, and Poland. And we're working currently on the next version, the 26 version, which should be out in Q3, and which will sort of further build on the principle and the definition we did last time, and this time take an approach where it also then becomes a practical tool so you can measure. Because one of our key conclusions we sort of struggle a little bit with how to present it, because a key conclusion from our end was actually there was a significant lack of data across many of these metrics. We're just not collecting all this info. And you can argue that once we've collected it, people then also want to see action. So maybe there's a reason why some people are not keen to collect. But what we're certainly trying to do is to collect now consistently this data so that we can build, we can see where the starting point is, but then also see to which extent we have then moved forward. And I think that was all I wanted to say.
Julie, I take my hat off to you. It's a masterclass in speaking without the slides that you're anticipating seeing, so very well done. And really interesting points that you made there. And oh yes, please take a seat on the high stool. Thank you very much. Yeah, really interesting to see the absence of a clear definition of what constitutes a healthy building, which you would think, I suppose, everyone has their own impressions, and until you try and write it down, you don't realise actually that it's a very difficult thing to define in a policy or in a formula. Also interesting that you mentioned the expectations around additional regulation, which I think leads us quite nicely onto Simon and his reflections, which will be around the policy implications of some of the topics that we've discussed. So I'm thinking particularly we've been talking about carbon, we've been talking about healthcare, well-being, all topics that the UK Green Building Council has been doing fantastic work on over the last few years, and I've heard Simon speak on these many times, so looking forward to what he has to say this afternoon. Thank you.
Cheers, Adam. Thank you. I'll just get out of the way over here. Yeah, thanks, Adam, and thanks to the Star Group for having me here today. I'm Chief Executive UK Green Building Council, so I won't explain what we do because we're the sister organisation of Liz in the US, and we do pretty similar things to them. But as well as doing a lot of work on net zero, resilience, nature, we've got a long legacy working on across health and well-being and buildings across the built environment. And I was delighted last night to be asked by Bronwyn to be part of the event around the Global Pledge, and I'm very proud to wear my canary badge here today. If I focus in on the UK for a moment, we're sort of between a rock and a hard place on this. We've got the oldest, leakiest housing stock in energy terms in the whole of Europe. The government are failing to a large extent, but trying to accelerate action to renovate and refurbish that housing up to suitable energy performance standards. But they're doing things in a siloed fashion, which other people have spoken about already, and a result is that we are racing ahead against some of those targets where we don't have enough skills and a suitable supply chain developed around that skills base to consider things like indoor air quality and wider considerations around building resilience. I think, like a lot of other countries, that sort of, and Australia is the same, I think, we spend about 90% of our time indoors in the UK. At the same time, our National Health Service spends about £1.5 billion a year on illness related to damp homes, and another £27 billion a year on respiratory illness around other air pollution issues. And the Global Pledge, which came out in September, it's very poignant timing for us in the UK. Just a few weeks ago, last month in October, a law was introduced in the UK called Awaab's Law. And Awaab's Law puts a legal duty on landlords of social housing to rapidly address damp, mould and other similar air quality affecting criteria in their properties. It's very poignant and sad because Awaab Ishak was 2 years old when he died from respiratory illness caused by poor indoor air quality in a damp social home. His family have campaigned for the last few years around the issue, and they've got this law into place. But it's bittersweet in the sense that, as well as the obvious tragedy of him as a young boy, but it's a bilateral intervention solving a small piece of the problem. And what we don't have in a UK landscape, and I think in a European landscape it's mirrored, we don't have the systemic level approach to this around health indoors, around resilience more widely in our buildings. working with individual companies across the Sidara Group and across our membership, we've just launched a climate resilience roadmap for the UK. So that has measured 5 major hazards that are escalating in Britain. That's wildfires, drought, flooding, extreme weather events, and overheating in buildings. And the summary position is that we're facing not just a hotter, wetter, wilder future, but we've got that hotter, wetter, wilder climate with us already. So in 2022 in the UK, we had 3,500 excess deaths above the norm from building-related heat incidents. And, you know, I know it's awkward speaking in front of Australian colleagues about wildfires, but, you know, we had wildfires are increasing, doubling per every 2 years in their incidences. And, you know, we had wildfires even in the centre of London ripping through a suburb called Wennington just 2 years ago. And what our resilience roadmap that has really indicating is that we need to start treating the resilience requirements as national emergencies. And it shows that they're actually incredibly interconnected, these different hazards. And the problem is in the UK, we're treating each individual thing as an individual problem, if it's flooding or if it's overheating in buildings or if it's around extreme weather events. And the problem we've got, and it's a phrase I used at last night's event, is because everyone owns a little bit of the response, nobody owns the problem. And as a result, we're not getting the sort of matched together example that we get. And if I think back to those stats that I just used, you know, that hotter, wetter, wilder future is going to drive much more wet winters in the UK, going to increase further the fact that 1 in 6 of our homes already suffer from damp. That's going to increase. You mentioned the Hospitals at Home programme. My wife is a community nurse running part of the Hospitals at Home work in southwest Wales, and she's seeing some of the incidences coming from the housing related impacts affecting the ability to do this. So as they're trying to roll it out and scale it, they're being inhibited to an extent by quality of housing at the same time as well. So I guess if I just come back to the policy responses at a UK level that we'd really like to see, so because of the overlapping nature of the response needed from the Department for Environment, the Department for Energy, Department for Housing, Health, etc., we've been advocating for an Office for Resilience in the UK, which would sit in a department called the Cabinet Office. And for anyone not familiar with UK politics, that basically sits and reports directly into the Prime Minister. And the idea is that because resilience needs to be a pan-economic, pan-societal response, and the health impacts from that, we have to centralise that in a pan-economic department within government. We're also looking at the multiplier effect of dealing with health and resilience damage impact versus dealing with it in advance. So we've built a treasury model whereby the treasury should be dropping a resilience consideration lens in front of all of its spending decisions, so that it's looking at how the UK's climate is changing over time and whether it needs to make different decisions at the front end based on the changing environment that it'll have to be dealing in. And if I just use one more example around how the UK is doing it in a very odd way. So we actually, despite the fact UK, GBC and all of our partners work in this space completely, we found out by accident a couple of weeks ago that government had independently developed a healthy homes standard in the UK. They're also developing a future home standard in the UK, which we've been heavily involved in, which will determine the calibre in energy terms of energy and safety terms of all housing and all commercial buildings for the next generation. But they've ideated the healthy home standard in parallel, and there's absolutely no link between the two regulations or groups. So it's just a real encapsulation of the policy level challenge that we get in this space. And I guess the last two parting comments from me about things that we're really pushing on policy to address this. One is a devolution of, an accelerated devolution of power from national government to local authorities and cities. Local authorities and cities know their patch the best. They know the skills, the supply chain, the housing stock, the building stock the best. They should be the ones dealing with resilience and health responses locally. It shouldn't be a top-down initiative. And the last thing we're doing is we've got a lot of program work across our nature program and bridging into the resilience space around the need to increase green space in urban areas more generally. Obviously, large enhancements of green space, A, bring down localized temperatures and address some of the overheating concerns. B, address air quality externally and by extension internally and provide improvements from the cleansing effect they can bring. And actually just more widely for health and well-being more generally. There's a lovely little mini campaign that we're supporting in the UK called 330-300, which is that everyone should be able to see 3 trees from their window. They should have 30% tree canopy cover in their local authority, and they should be no more than 300 yards away from a green space or park. And actually that brings a lot of joy and amenity value, but is doing the hard lifting for the big environmental requirements at the same time. And I think we should be always trying to centralize nature as that heavy lifting component in a lot of this work.
Fantastic. Thank you very much, Simon. And yeah, amazing to cover so much ground so quickly, and really useful, comprehensive reflections on how all of these aspects knit together and how our health is so massively affected by the environment that we spend most of our time in, our homes and places where we work. We had a conversation yesterday where we were talking about the transport sector, and again it turned to the importance of health as being a key priority in shifting to decarbonising mass transit systems within cities. And there was a reflection around, actually we don't talk about carbon, we don't really talk necessarily about some of the statistics, we talk about how this improves people's quality of life. That's the key thing we want to communicate more widely. And I'd like just maybe to turn to you, Julie, to ask, how do you go about communicating these health and well-being benefits to consumers, to people who are choosing where to live and how to design homes in a way that's most meaningful to them?
I think part of the reason why we've been doing this piece of work for a number of years is to be able to have that hard data as well in terms of the financial savings, because if you are Mr. and Mrs. Average, then you care about, just your health. But if you run a hospital or a big office, then your financials also matter. And by having that data now, we're able to enter those conversations that used to be just about the performance of the building and add this on as an additional benefit. We're sort of very much about taking the holistic approach, because when you build a building or renovate a building, you want it to stand for the longer term. And so you need it to be efficient, but you also need it, to your point, to be resilient, right? You need it to be adaptable. That's another sort of key focus area, especially in Europe. We've got small, cramped countries. We can't afford to build new, and we have nowhere to build new. So we need to make sure that whatever we have now works, and whatever we build is also adaptable to different users over time. And so I think it's that plethora of good solutions that together make a difference. And what we're also seeing in Europe now, at least in some countries, is that there is a coherence between how well your building performs and the sales price. So it is increasingly becoming a driver, actually, also just for selling or for renting, because what we're doing is we're basically cutting off the bottom of the market every year, and with that we're sort of forcing people up in terms of in terms of the performance of the building. Then I think you said the silo approach. We have exactly the same issue, and that's also why I start off by saying that most of our regulation is built around the building performance, because that's where it sits. We have now in Europe a commissioner who's not just in charge of energy, but also for housing. And I mentioned that not to specifically talk about housing, but because what they did for him, for the first time that I'm aware of anyway in the Commission, is that he actually put a task force together of the relevant people from across the different departments. So also the health people, also the climate people, also the employment people. And that is for sure the way forward, and what we need to do, to have that integrated approach, to have all the right people around the table, so that, to your point, you don't realize by coincidence that someone's come up with a, for you, highly relevant topic that you haven't actually been asked to provide any input on.
Thank you, Julie. Sorry.
Just adding to that real quick, great points. From a company perspective, they might have all different goals, but there 90% of a company's cost in a building is the people in the building, and maybe 10% is the building, the rent, utilities, and so on. So if you can support health and wellness, improve productivity, fewer lost days to being sick, etc., like there is a financial value to that, whether you like quantify it or not. I think that's real, and people get that, and I think that's part of what we're trying to see too. There's some data on that. There's definitely data from a research perspective on, lower CO2 levels, higher oxygen levels, and cognitive function, and some of that. And so I think there is more data to help project teams that want to take a holistic approach and to really support that as they go through the decision-making process.
Brilliant. Thank you very much for that additional comment. I'm conscious that we need to finish quite quickly, so I would just like to, just as we conclude, just to pass the microphone to Mary to just perhaps give us some reflections on particularly how your passion, which is around healthy materials, actually talks to this topic of indoor air quality. Just sort of a few key points as to, do you see that there are challenges with specifying low carbon materials and specifying healthy materials, or are they're very complementary and lots of synergies between those solutions?
Thank you. I think kind of in a wrap up, I am extremely excited about what's happening to the materials market. We are mapping and we are figuring it out. We've been extremely collaborative across private and public sectors in terms of sharing information. We're mapping the health effects, we're mapping the embodied carbon, we're mapping where materials are coming from. And we're able to share through API and real updated information from manufacturers so that we can make these smart selections. And I think it's something that we can learn from the rest of our other solutions in terms of what we're bringing in and bringing in real-time data in terms of some of these updates. So it is certain an industry where we have a lot of collaboration. We're starting to crack the nut, so to speak, right, in terms of getting the solution to everyone's hands to make proper selections. We can do the same in terms of some of the other solutions that we're working on, especially health and then overall carbon impacts.
Lovely. Thank you very much, Mary. I will now conclude this evening just by saying thank you very much to the speakers and panelists. Really broad range of topics covered around health and the relationship to the built environment, and really useful points that came out. So thank you for raising those, and wish you a very enjoyable rest of the COP.